Hi, I'm Heather Rehil-Crest. I'm a clinical psychologist in Coeur d'Alene, Idaho, and I'm going to be talking today about something called complex trauma, and along with that, something called adverse childhood experiences. I specialize in something called neurodevelopmental disorders, which are various ways that the brain is impacted during early development and can result in some cognitive changes and some emotional changes as children get older. And one of the ways that the brain can be impacted is through adverse childhood experiences and what we call complex trauma. So I'll be talking about that today, and specifically as it relates to adults and teenagers who eventually go on to abuse substances as part of a coping mechanism related to those early stress effects. So as we get started today, I wanted to highlight some differences between what we call complex trauma versus post-traumatic stress disorder. I think most people here are probably pretty familiar with the term post-traumatic stress disorder, or PTSD. And some people may not be as familiar with the term complex trauma. Complex trauma is basically a phenomenon that happens when somebody has experienced multiple stressors early in childhood. And they're generally, the stressors are generally not life-threatening sorts of experiences. So it can be things like abuse, being very scared in a car accident, things like that. Whereas PTSD is a sort of a phenomenon that develops out of a person either experiencing a life-threatening situation or witnessing a life-threatening situation. And it has a lot more definition in psychological research in terms of what this disorder consists of. PTSD is a specific diagnosis in the DSM-5. Complex trauma is not. Complex trauma has a lot more controversy around what this is, what this means. And so as the field of psychology develops and continues to explore the effects of various things on humans, I'm assuming that we'll have more definition in the future. But right now, if a person came to me with lots of little stressors in childhood and had some mental health effects from that, there's not a diagnosis that I would give them that looks like complex trauma. So they might become diagnosed with anxiety or depression. Things like that are really common, even though the origin was within these series of traumatic events in childhood. There is research on complex trauma. And so some of the studies that you can see in the slides look at neurodevelopmental changes. And so we know that with complex trauma, it can cause some problems with how the left hemisphere of the brain is organized as a person gets older. It can affect how the prefrontal cortex is organized, and then it can also affect the anterior cingulate, which is a portion of the brain that is sort of correlated with empathy, impulse control, regulating your mood, paying attention, things like that. PTSD, on the other hand, has more specific symptoms that go with it. So there are things like flashbacks, nightmares, intrusive thoughts of trauma. Those are things that are very specific to these large traumatic events that can happen at any point in life whereas complex trauma may not have the kind of the common symptoms of PTSD, things like flashbacks and nightmares. PTSD also changes the brain. One of the things that it does is that it can disrupt a part of the brain called the amygdala, which helps in things like fear regulation and bonding with other people, kind of our attachment. And so there's, with PTSD, there's evidence that it increases the circuitry in the amygdala, which potentially can make a person more likely to experience a fear response if they're faced with a later stressor. And then there's also evidence that with PTSD, there's a decrease in the ability of the hippocampus, which is a region of the brain that helps with memory storage. There's a decrease in connectivity in the hippocampus. And so that's important because when we talk about treatment here in a little bit, a lot of what we're doing is relying on people to recall and remember aspects of trauma. And when there's been a traumatic event and they have PTSD from that event, the problems with the hippocampus can really impede them being able to do that. So there's definitely a strong association between substance use disorders and a person having experienced some sort of adverse childhood event earlier on in life. The National Institute of Health did a study that indicated that 70% of adolescents who were enrolled in drug treatment programs reported a history of some kind of trauma. That could be complex trauma, that could be PTSD, but some kind of trauma. And then there are also some studies that show that adults in drug treatment programs, a large portion of them met DSM criteria for PTSD. So that would be that very specific type of trauma. But 97% of the people in this study who were enrolled in drug treatment programs had some sort of complex trauma in childhood. So a very, very high number. So today, as we talk about trauma and specifically complex trauma, the order that I'm going to talk in are, number one, the factors that sort of cause complex trauma, and then we'll talk about protection factors, so resiliency. What are the things that keep us from developing mental health effects from having these repeated stressors? And then last of all, we'll talk about what we can do for people who have complex trauma. What are the treatment options? So first off, many people have probably heard the term the ACEs study. That's a pretty common thing to talk about in the medical field. The ACEs study was a large longitudinal study that was done back in the late 90s. It was a collaboration between Kaiser Permanente and the CDC. And they looked at a number of physical and mental health effects and looked at all of the factors that they could find that predicted these outcomes. So these would be things like, the later outcomes would be things like heart disease and diabetes and strokes, and also things like depression, completing suicide, in addition, just kind of life effects that are negative. So poverty, having a dysfunctional family, divorce, things like that. And so they found, when they did a meta-analysis, that there were 10 specific factors that predicted this whole slew of problems in adulthood. And they broke these 10 factors into 3 basic categories. So the categories include abuse, which would be something imposed on a child, neglect, which would be something withheld from the child, and then the other 5 factors were family-related stressors. We'll talk about those more in detail. So abuse is probably the most commonly thought, the thing that people most commonly think of when they think of ACEs factors is child abuse. And so these would include physical abuse. So this would be a parent or a caregiver intentionally injuring the child. So it's not, it doesn't count if it was an accident. But if the adult's intentionally injuring the child, that is an example of physical abuse. Many children will have physical injuries from abuse, but not always. I attended a really interesting training a couple of years ago that was put on by law enforcement, and they talked about how frequently kids who have been physically abused don't have any physical injuries. And we watched videos that had been taken from like nanny cams of babysitters who were abusing children, and parents would discover this on a nanny cam later and take the child to the hospital, only to find out that there was no evidence physically, no bruising, no fractures. And as I watched those videos, it was shocking because we would witness, babysitters throwing babies against a wall, no injury from that. And so I think one of the reasons that I bring up that is that quite often in the healthcare setting, we may not be able to tell if there's been any kind of physical injury. And so just because there's an absence of an injury does not mean that abuse has not happened. So then the other form of abuse would be inflicting harm in a manner that could injure a child through carelessness, right? Through not just accidents, but being angry and shaking the child. They maybe aren't intending to cause a brain injury, but the effects of that adult behavior and that loss of emotional control does result in physical abuse. And there's research that shows that physical abuse really does impact brain development for a lot of kids. Not all kids, but a lot of kids will have really clear changes in their cognition. So there was a big study back in 1997 that looked at how does abuse impact learning for kids. And one of the things that they found was that children who have been abused are much more likely to have underdeveloped left hemispheres. The left hemisphere, most of you probably know, is really responsible for a lot of our language-related tasks as humans. And so as children are developing, their language is developing. And children who have been abused are much less likely to be able to access language, to be able to engage in verbal problem solving, things like that. Which again is important since many of our treatments for trauma include talk therapy, include that sort of mechanism of talking about what has happened in the past. The study also showed that there's a lot of evidence that there's connectivity issues between the two hemispheres of the brain when children have been abused. So the left and right brain, are not communicating back and forth the way they should, which again, it makes it harder for a human to regulate their experiences and to integrate emotions with their experiences when things are not connecting correctly. And then they also found that abuse directly led to problems with executive functioning. Executive functioning would be kind of our ability to engage in goal-directed behavior. So planning, predicting outcomes, sort of seeing if there's a problem with a strategy that we've implemented. And so problems with executive functioning make life really hard for people. If we can't do that, things become really laborious. Simple tasks are harder to complete. And so it can make a person who's already stressed out have even more stress in daily life. Sexual abuse is kind of interesting. A lot of people assume that sexual abuse would be the worst kind of abuse. And I get that. I think there's, that it seems like a very scary thing for a child to go through. Examples of sexual abuse would be an adult, having sex with a child or sexually touching a child, exploiting the child, exposing themselves to the child or trafficking the child, showing the child pornography. What we know is that when it's sexual abuse that does not include physical pain, so if the adult is not physically hurting the child, that typically the effects on neurodevelopment, they kind of echo the physical abuse. So some of the same things, problems with the left hemisphere, problems with left to right integration, problems with executive functioning, they're still there, but not to the same degree as physical abuse. So sexual abuse is bad and terrible for a lot of reasons, but fortunately, it seems to have a less of an impact on learning for a child. And then emotional abuse, which is really a tricky one. Emotional abuse basically happens when an adult is intentionally interfering with the child's sort of sense of safety and well-being on an emotional level. So these would include forms of verbal abuse, so calling the child names, ridiculing the child, belittling them, yelling, using scary volume of voice, especially for young children, babies, somebody yelling at a baby. That's very scary. They don't maybe understand the language yet, but they understand hostility, tone of voice, and volume. It's also, there's also mental abuse. So mental abuse would be just kind of things that adults do that can be, that place the child in a situation where they're confused about what's happened. So these would be things like if a child's crying, a parent saying, "You're not sad, you need to be happy." A parent rejecting the child goes to reach to give the parent a hug, and the parent rebuffs the child and says, "No, I'm not going to hug you." Giving the child the silent treatment. Parents sometimes have had their own trauma, and one of the really common things we see in parenting research is that certain personality disorders will parent their kids by giving them the silent treatment when they're mad at them. And that can be very, very damaging for a child. And then there's psychological maltreatment. So these would be things like treating the child in a really dehumanizing way, making your little boy wear a pink dress to school as a way to shame him, intentionally pointing out all the child's faults in front of their friends, things like that. And what we found is that in the research that looks at learning and emotional abuse, the neurodevelopmental impact for emotional abuse is actually worse than for sexual abuse. It's about the same as physical abuse. So it's very, very harmful. And so overall, when there has been some research that's looked at sexual abuse without any other ACEs factors versus physical and emotional abuse without other ACEs factors. So I wanted to talk about that a little bit because it's kind of interesting. One thing I would point out is that I think in clinical work, we almost never see somebody with just one ACEs factor. It's almost always going to be multiple. But there have been some studies that have looked at if a child was just sexually abused, but no other harmful events happened, what we often see are a lot of attachment and relational changes. So these would be things that would impact the child's biology at times. It can change their physical maturation processes when they enter puberty, things like that. And it can also impact their mental health boundaries around how to form attachments and relationships with other people. So there are a lot of red flag behaviors for children who've been sexually abused, where they don't have the same awareness about safety and about what information is okay to talk about versus information they should keep to themselves, and that persists into adulthood. They're less likely to have the PTSD kinds of effects. So things like nightmares, flashbacks. If it's just sexual abuse and no other ACEs factor, those symptoms are not as frequent. And then physical and emotional abuse without any other ACEs factor has been found to produce a lot of anxiety in children. So when a child might be afraid of the dark a little bit, which is developmentally appropriate for younger kids, having that physical abuse history will often intensify that normal fear reaction. And it also may cause that fear to persist much longer outside of what would be developmentally appropriate. So you might have a 13 or 14-year-old kid who still is very afraid of the dark. It can create something called magical thinking. So a lot of kids who have been physically or emotionally abused, when I see them in my practice and I ask them about, like, what do you want to do when you're a grown-up? They talk about, like, I'm going to be an NFL star. I'm going to be a famous singer. And there's a lack of kind of realism in sort of their understanding about what life will hold for them. And then there's also something called an exaggerated startle response, which is exactly kind of how it sounds. And basically just when something happens in their environment, instead of their brain kind of soothing them and telling them that it's okay, they need to get more information, they have a fear response very, very quickly. And so those are all things that are correlated with physical abuse. Physical abuse also has a high rate of what we call a disorganized attachment style, which is the worst kind of an attachment problem. We'll talk about that more in just a second. But more than sexual abuse, physical abuse tends to result in very disorganized attachment. So the second category with the ACEs study is neglect. And this is broken down into physical neglect and psychological neglect. So physical neglect would be not caring for a child's physiological needs. So their needs for sleep, food, nutrition, shelter, medical care, things like that. Psychological neglect is not caring for the child's emotional and social needs. So these would be things like a parent who is very disengaged from a child, is not talking a whole lot, not reading to the child when they're little. The parent may not provide very many opportunities for social interactions. They may not teach the child, basic math or their letters, things like that. And often they're withholding emotional warmth. So they're not hugging, kissing, tucking their kid into bed, rubbing their back at night, soothing them if they are upset or if they've gotten hurt. And then another important part is they're not playing with their kids. So they're not allowing that child to have an opportunity to do something fun and enjoyable with that parent. So while we're talking about neglect, it's important to talk about attachment. I'm guessing with most of you being in the medical field that you've all heard the term attachment. And so when I talk about attachment, I want to point out that it's not the same as a relationship. So there's a difference between those two terms. For kids who have a healthy attachment style, you can have a bad relationship with a parent, but still be healthy in your attachment style. Attachment is really talking about a very early neurological template that develops between a baby and a caregiver. And it's typically developing most of the time between about 5 months of age and 3 years of age. That's the really critical time. Before 5 months of age, trauma can still impact attachment. So severe neglect, scary things for an infant can certainly still impact them. But for most babies, until about 5 months of age, they're not as vulnerable to like changes in caregiving or parental neglect if it's more moderate to mild. Between ages 5 months and 3 years of age, and some research says until even 4 years of age, this is a time where little children and babies are learning how to be a human. And so the three dimensions of attachment are, number one, autonomy. So they're learning what is their body versus the rest of the world. What do they have power over versus the rest of the world? It's also looking at how do you stay safe? If there's something that frightens me, if I feel threatened, how do I get help or how do I stay safe? And then it's looking at social enjoyment. So again, play. And so as our brains, when we're very little, are developing, all three aspects of attachment help us to achieve kind of normal functioning as an adult in terms of social skills and emotional regulation. There are 4 basic attachment styles. There's a number of researchers have looked at attachment going back, into the 1940s and 50s. And so Mary Ainsworth is probably one of the most famous researchers on attachment. She developed a study for infants called the Strange Situation, where she would place infants and their caregivers in a room, and she would have a caregiver, typically the mother, leave the room, and a stranger would enter the room, and then the stranger would leave and the mother would return. And Ainsworth was studying what did the babies do when the mother left, when the stranger entered, when the stranger left, and when the mother returned. And she discovered that there were 4 basic categories of how babies would react. So first off, some babies were very secure. And this is considered the healthiest form of attachment. So for secure babies, their mother would leave the room, they would cry. And a stranger would enter and they would cry, but the stranger could comfort them a little bit. And then the stranger would leave and mother would come back, and right away the baby would allow the mother to soothe the baby and they would be okay. Anxious avoidant was the second category, and this is still considered to be a healthy attachment style, but it's less healthy than secure. And so anxious avoidant babies basically would reject the mother when she came back into the room, so that they would not allow her to soothe them. And then anxious ambivalent, the third category, these babies had very sort of push-pull kinds of reactions. So when the stranger would enter, quite often they would reject comforting. When mother would enter the room, they would initially reject comforting and then allow comforting, and sometimes be very clingy with mother, not allow her to leave kind of their area in the room. The fourth category is the most problematic. So this is an unhealthy attachment style. This is called disorganized attachment. So this is very highly correlated with physical abuse. And when in situations where they're studying this, when the mother would return to the room, or when the stranger came into the room, basically the babies would stay disengaged the entire time. They often would have a very flat affect. They did not respond to comforting. They were not distressed with the parent leaving. And so that is a predictive factor for a lot of mental health problems, a lot of personality disorders when kids get older. So neglect and attachment are very, very important. And one of the things that we know is that if a child has been protected from neglect until about age 4, they're likely to develop a healthier attachment style. So if they have not been abused or neglected, attachment generally is going to form okay. But when a child's under 4, neglect can be very impactful for their attachment. So one of the reasons is that they're given often too much autonomy. So again, looking at kind of those 3 categories: autonomy, seeking safety, and play, those 3 categories of attachment. Neglectful parents are often overly permissive, so the child basically decides exactly what they're going to do, and they often are put in a position to kind of fend for themselves. I see kids in my practice who have been neglected, who would climb up onto cupboards to get cereal for them and their younger sisters or brothers because a parent wasn't feeding them. And so those are behaviors that for most 3-year-olds, we wouldn't want them to have that responsibility to do that. They also don't find the parent to be a source of pleasure or shared enjoyment. That parent's not playing with the child, and so that child's not associating a parent with being something that's fun, something that they can go to and have fun with, which is an important part of social development. And then if the child experiences significant neglect and abuse prior to the age of 4, again, that disorganized attachment style is a much, much higher risk. So both neglect and abuse together often will produce that disorganized attachment style. The third category within the ACEs study is family-related stressors. And so there are 5 basic family-related stressors. The first one is mental illness in the parent. It's kind of interesting. A lot of times there's an assumption that like the bigger mental illnesses are probably going to hurt kids more than maybe the smaller mental illnesses. And what we know is that for young children, maternal depression is much more likely to cause some sort of complex trauma compared to maternal schizophrenia. So a big diagnosis like schizophrenia is generally not going to be as harmful to a young child compared with maternal depression. So for those of you working with moms who may be at risk for, like a peripartum depression, keep that in mind, and that's a really, really risky thing for a baby to have a mom who's severely depressed. The second category is having a relative who is incarcerated. So having an uncle, a grandpa, a dad, a mom in prison. And essentially Prison changes the family dynamics quite a bit. We're not able to visit as often. It can be a very shaming thing for a family to go through. It creates a lot of financial stress on the family. Often people have to travel really far to get to even visit the person in prison. So that is another common risk factor. The third family-related stressor would be exposure to domestic violence. So we know that when a child is present for some kind of intimate partner violence, that actually can cause post-traumatic stress disorder. And so again, with post-traumatic stress disorder, it's generally going to happen if you're afraid for your own life or the life of another. And so many children have seen, a parent being attacked by the other parent and been very afraid that that parent would die. And that can cause active PTSD, as well as even if it's yelling, even if it's shoving, things maybe that are not life-threatening, it's very, very stressful and will again cause more of that complex trauma. One of the things, too, that happens in domestic violence cases is that we often see kind of a delayed response in childhood symptoms. So it's called the sleeper effect. It happens more with girls than with boys, but quite often girls who are in a family where domestic violence is occurring, they cope pretty well at the time. But then when they hit adolescence, they start to have a lot more internalizing symptoms, a lot more anxiety, depression. Boys have a lot more externalizing behaviors, so more fights, acting out, impulsivity. And so one of the things I often caution parents about if they've left a domestic violence situation and they're kind of considering whether they should do treatment, one of the things I often talk to them about is the fact that even if their kids are pretty good right now, that doesn't necessarily mean they're not going to have some symptoms later, and kind of prepare them that that's possible for those kids. The other two family-related stressors are substance abuse and divorce. Substance abuse is highly correlated with neglect of a child. So when a parent is using a substance, they are just not able to really focus on the child. And it can cause a lot of inconsistencies in parenting. Most of you know that when you're a parent, you have to be consistent. That's the best way to parent a kid. And so when you're sometimes sober and sometimes not sober, your behavior, your expectations for their behavior is going to shift around a lot, and that's very confusing for children. Divorce is one that also made the 10 factors. And typically when I read about this, it's talking about more high conflict divorce. So when parents are not in agreement about the children, when they continue to argue in front of the children, that tends to be a more stressful situation for the children. When children are very young and divorce happens, it can cause attachment injuries. So if mom and dad split up with a 2-year-old and the 2-year-old is maybe living with dad week on, mom week on, and having a schedule like that can be very damaging for them. And then divorce can also cause a lot of stress for older children. So even if it's not an attachment issue, it's a huge change in their family dynamic and can be very, very stressful. So let's talk about the protective factors. Not everybody who has experienced some sort of adverse childhood experience will develop complex trauma or PTSD. Children who have higher IQs tend to be safer Children who have more cognitive flexibility, kind of being able to predict outcomes, prioritize information, some of those executive functioning skills, they tend to do better. And a belief in a moral authority is also predictive. So sometimes that's a belief in God, and kind of this idea that there's a power out there that's bigger than us that can help us, and that's looking out for us. Temperament also matters. So, babies are born with different temperaments. And so a more easygoing, kind of optimistic temperament tends to have a better outcome than a more cautious or fussy temperament. And these children are often able to process their emotions better when they're playing or when they're talking to somebody else. So it sort of keeps them at a more regulated place as they're interacting with other people. Behaviorally, children who get a lot of physical exercise, that tends to be protective against an ACEs factor causing trauma. So kids who are actively in sports, and children who are able to adhere to a routine, kids that are good at routines and kind of know what to expect, tend to do better. Children who have fewer PTSD symptoms or mental health symptoms like aggression. If they're not aggressive, generally they're going to get along with people better. They're going to get more positive feedback from teachers and from other kids, and that's protective for them. And then there are situational factors. So social support is a big one. If a child has experienced some of these ACEs factors and they have really supportive teachers and grandparents and aunts and uncles, they are going to do much better than a child who doesn't have any kind of extended support. Another part that comes into play a lot with older kids is their level of autonomy with decision making. Quite often I'll see kids who are forced to go and talk to a therapist when something traumatic has happened to them. And sometimes that's a good thing, but quite often it can backfire because the child doesn't make that decision on their own. And so there are ways to sort of encourage that or to try things. And when a child feels like they have a say in going and talking to somebody about this, it tends to be protective for them. There are also some variables that go along with caregivers. So parenting can be very, very protective for kids who've had an higher ACEs score. Parents who are good at problem solving generally are going to be able to predict stressors as they come up and sort of help kids to stay away from things that are really stressful or being overreactive in parenting. Parents who can regulate their own emotions, who are not going to freeze when the kid is getting really hyper and dysregulated, but they're able to contain that level of energy and bring that child back to a more regulated state. Or a parent who doesn't freak out, start crying or screaming, if a child is having issues. So having a calm parent who can stay engaged is very protective. And then parents who are just loving, giving the children kisses and hugs, safety, predictability in their routine, that is very protective. And then play. Play is one of the most important things parents can do with children. It really helps with empathy development, helps with bonding, helps to produce happiness in the child. So play is also a really protective thing to do with kids. So treatment, for complex trauma is controversial. So the biggest thing I would emphasize is that if we don't want people to have complex trauma, the easiest thing to do is to prevent it from happening, to make sure children are safe, to make sure that people have enough support so that neglect, abuse, and some of these other family-related factors are not happening as frequently, or they're not happening together. However, we're not in a perfect world, and so sometimes these are going to happen. And so treatment options, if somebody has developed complex trauma, they're broken down into sort of biological modes of treatment, psychological, and family modes of treatment. And so the psychobiological treatment goals would be essentially to improve impulse control, and to decrease the person's stress response. With trauma, if we can get people calmer and if we can get them to act in a way that's not impulsive, it tends to allow more correction for that trauma. It also, another goal would be to help reduce some of the intense emotions that can sort of damage the brain. High levels of stress, depression, anger are all correlated with increased stress hormones and then decreases in brain hormones that really protect the brain. And then it's going to look at kind of enhancing sort of that interconnectivity. So getting the person or the child doing lots of different things as a way to increase kind of neural circuitry. Forms of psychobiological treatment would include sensory integration therapy. There are therapists who do something called drumming and rocking. This is more for kids who have been abused or neglected at very young ages. And so the idea here is that a repetitive movement is sometimes very regulating for them physically. And so there's a lot of emphasis on, maybe having foster parent take that child and just rock them to sleep every night rather than rubbing their back. Medication is a really common one, probably the fastest one for many people with trauma. Yoga, very, very helpful for a lot of people with trauma. Mindfulness and meditation exercises. These are often taught by a therapist in a psychotherapy setting, and these can also have a really good impact on stress hormones. Practicing good sleep hygiene and getting physical exercise are all very healthy and helpful forms of psychobiological treatment. Psychological treatment, which would be more what people would be getting with a counselor, with a talk therapist. These treatment goals look a little bit different. So one of the things that's going to be focused on would be helping a child learn to regulate their emotions, accept their painful feelings. A lot of the goals would be kind of looking at trying to reduce any kind of acting out behavior that produced problems in the family. And so the modes here can be through play therapy, especially for younger children. That's a great way to get them to explore all those different pieces. For older people, adults and teenagers, there's a cognitive behavioral therapy that's specifically for trauma called TFCBT. There's something called prolonged exposure therapy that's often used in cases of trauma. And there's also something called eye movement desensitization and reprocessing, EMDR, which is also a very common treatment for trauma. There are also other treatments that are kind of growing in their robustness in the research literature. And so I'm assuming as time goes on, additional forms of therapy will be added to that list. And then another form of treatment would be through the family. So this is really kind of changing the patterns within a family of origin that contributed to the neglect, abuse, or other family-related factors. So it would focus on helping parents be safe, helping them provide age-appropriate autonomy, giving them coaching and skills so that they can interact with the child in a healthy manner, and so that the child has those opportunities for shared enjoyment. So these would be things like validating the child's feelings. And part of this is also taking accountability for the things that they've done that have damaged that child, that have hurt that child, and to show remorse, to show empathy. So this is often going to be done by a family therapist, in conjunction maybe with even like CPS and foster care. So I know we're about out of time. So I just, in closing, I just wanted to emphasize that, complex trauma, I think, is a societal problem. It's very complicated, and there are things that we can all do to kind of protect each other and be kind to each other, especially when we're looking at little kids. Children definitely benefit from social support, so mentorship, big brother, big sister programs, just being kind to your child's, friends in the neighborhood can be protective. Kindness and validation of feelings really do matter. And so if there's a kid talking about a problem, just always remember, we don't need to teach them anything in that moment other than, that their feelings are real, and that can feel very, very good to a person to be seen and to be validated that way. So in closing, go home and play with your kids, or play with somebody else's kids if you don't have any. Thanks.